And when you're self-harming, it's not painful in the time. During that time, it's just signs of relief. You feel relief whenever you release blood.
Faith Agumya is one of the Ugandans struggling with the challenge of suicidal thoughts and self-harm since her childhood. She has, however, survived being a suicide victim through socializing with community that has made her realize that where there is weakness, there is strength. She advises people facing depression and anxiety, some of the drivers of these suicidal thoughts, to keep in company of people who understand their weaknesses and those that know what they want. According to statistics from Ministry of Health, over 2,500 Ugandans were lost to suicide in 2021. The Permanent Secretary, Ministry of Health, Dr. Diana Atwine, attributes the increased cases of suicide to the silence by those who fall victims, emphasizing the need to direct strategies for prevention to community level.
Can't look at only the facility, we must look at the community, and gender is very critical. Education is very critical. So there are certain things that we must coordinate better.
Ministry of Health integrated mental health in lower primary health care. However, still the number of psychiatrists deployed by government is inadequate, yet even regional referral hospitals lack psychologists.
I think we only have the clinical psychologists in just a few of the regional referral hospitals, I think just 2 of them. And then, of course, the majority are now in Watavika Hospital.
Dr. Hasfalukwata explains that the psychological first aid for mental health is talking to the patient. However, there are severe cases that will require medication.
The medication comes, yes, in 2 situations. When it is severe, when someone is having severe depression, you know, for most of these conditions, there are different grades. Someone can have mild depression, and then they can have moderate or moderately severe. And then
the chairperson steering committee of the Life Conference 2025, Andrew Rugasira, says as civil society, they want government to come up with a national policy on suicide prevention, plus decriminalizing attempted suicide because it is a mental health problem.
Which is make them part of the solution, not just to see our young people taking their lives. And 3, validate, which means accept that we have a real problem and this is an issue and what can we do about it. And E is empower, find solutions for them by creating resource hubs.
The month of September is Suicide Awareness Month, and the Live Conference emphasizes listening, including validating and empowering people struggling with suicide ideation, because every life matters. I'm Navka Farida in Kampala.